Navigating Medicare often feels like trying to fold a fitted sheet. It is frustrating, confusing, and you usually fail. But starting July 1st, 2026, the government is rolling out a temporary lifeline called the Medicare GLP-1 Bridge, bringing us a rare piece of actually good news. This specific program covers 3 highly sought-after weight loss medications: Foundayo tablets, the Zepbound KwikPen, and Wegovy. Looking at this chart of standard market costs, you can see the financial barrier. But under this program, that expense plummets to a flat rate of exactly $50 a month, regardless of your income bracket. The government doesn't typically hand out premium medications just so we can drop a few pounds for a family reunion. So what exactly is the catch to securing this $50 deal? The very first hurdle is administrative. To even be considered, you must be actively enrolled in a Medicare Part D prescription drug plan. This isn't a penalty. If you have those conditions, your standard Medicare plan typically already covers a GLP-1 drug for you, which makes the Bridge program entirely redundant. This is a targeted safety net for a specific demographic, leaving the question of what physical metrics actually get you through the door. Looking at this sliding scale representing body mass index, or BMI, the primary physical hurdle becomes clear. You need a BMI of 35 or higher to qualify outright. If your number falls a bit lower, specifically in the 27 to 30 range, you can still secure that $50 rate, provided you meet certain secondary conditions. To enter the program at that lower tier, you need to be dealing with some of the parting gifts of aging, like hard-to-control high blood pressure, a diagnosis of prediabetes, chronic kidney disease, or a history of heart issues. Don't try to guess your own metrics at home. Have your doctor formally calculate your BMI during your next visit. These specific metric requirements define the program as a calculated preventative healthcare strategy for aging bodies, rather than a vanity weight loss discount. Getting the medication involves a very specific sequence of events. First, you sit down with your doctor to confirm your eligibility, and they send the prescription straight over to your pharmacy. Your pharmacist then takes over, but they have to process that incoming prescription using your specific Medicare ID number. While that happens, your doctor works behind the scenes to submit a formal approval form directly to Medicare, authorizing the bridge pricing. Your only job is to wait for the official approval letter to arrive in your mailbox. Once it does, you can walk right into the pharmacy with a $50 bill and pick up your medication. Compared to the chaotic struggle of folding that fitted sheet, this 5-step pathway is surprisingly logical, proving that occasionally, government bureaucracy is actually manageable. Once you're officially in the system, maintaining your prescription gets even easier. You don't have to seek a new Medicare approval for future refills, as long as you stay on the exact same medication. There is one final piece of fine print to keep in mind. That $50 monthly fee does not count toward your yearly Medicare deductible or your out-of-pocket limits. But considering what these drugs typically cost, paying $50 out of pocket is still practically a steal. So take the initiative. Bring up the GLP-1 Bridge program and request a formal BMI check at your next doctor's appointment. Following these steps is a rare opportunity to cut through the red tape and put your tax dollars to work directly in your favor.